Welcome to our conversation on supporting graduate student clinicians who stutter. I'm Ana Paula Mumy, a speech language therapist and the president of Spero Stuttering. Spero is a nonprofit, for those of you who don't know, that seeks to help empower and advocate for people who stutter. And today our focus is empowering the next generation of speech language pathologists or speech language therapists. I have here with me 6 amazing SLPs who also happen to be people who stutter. And I'm just thrilled that they're willing to share their stories and provide us guidance on how to support clinicians who stutter. More than SLPs, these individuals are close friends and mentors, researchers, instructors, advocates, and I can say that they have enriched my life personally and have significantly influenced my work with people who stutter. So thank you so very much for being here. I'm going to just begin with brief introductions of each in no particular order, and you can just maybe wave as I introduce you. So we'll start with Chris Constantino. He is an associate professor at Florida State University, and he serves on Spero's advisory council. Derek Daniels is an associate professor at Wayne State University in Michigan, and we met at Camp Shoutout, an amazing summer camp for children and teens who stutter. My other Camp Shoutout friend is Kyle Pelkey. He's an SLP at Camella Communication Center in Illinois and a co-leader of the Camp Shoutout Community Connections virtual program. Jack Henderson is the owner and SLP at Henderson Stuttering Therapy in Nashville, Tennessee. And he co-founded Camp Talks, talking and learning with kids who stutter, and ran the camp at Vanderbilt through 2023. And he also teaches stuttering as an adjunct instructor at a couple of universities. Lauren Schlemmer is or was a school-based SLP and now works as an outpatient or at an outpatient clinic in Virginia. And I was privileged to get to know her when she participated in Spero's Extraordinary Ordinary SLPs Who Stutter campaign last year. And we spotlighted lots of SLPs who stuttered, and it was super fun to get to know so many of you. And last but not least, my sweet friend and colleague, Mandy Rodstrom. Mandy just launched her own private practice in the Virginia and DC area, Whole Care Speech Therapy, and she serves as a Spero ambassador on various special projects. And she's also an adjunct instructor at a couple of universities as well. So welcome to each of you. And this topic is just so important and timely because one, we have so many students who stutter who are applying to graduate school to become speech language therapists. And two, because stuttering is still often misunderstood, even by practicing SLPs and those in academic or clinical roles serving as clinical supervisors. Thankfully, our understanding of stuttering has grown, and as it's grown, we're learning from the lived experience of people who stutter. And so more and more supervisors are seeking guidance on how to support their students who stutter. So we're going to jump right in, and I'll just begin with an open-ended question, and you can unmute as you are ready to respond. So when you were a graduate student, what did you wish your clinical supervisors had understood about stuttering and your experience as a clinician who stutters?
I can jump in and take this one, Ana Paula, and it's an honor to be here. Thank you for having me. And so, yeah, I was very lucky that I felt as though I had understanding from my supervisors, a pretty good understanding about stuttering. But also, I think that one of the things I wish they knew is that the the amount of stuttering that I may experience is changing moment to moment, day to day, situation to situation, in that also how I feel about it is also changing depending on the situation. Um, and I think that for them to have continued check-ins with me would have been more helpful given the dynamic nature of what I was experiencing as a grad student over time. And open and honest communication where there's no judgment, and trying to understand so they know how they can support is really at the crux of it, of what is it I can do and bring to the table to help you to have to be successful, and leading with curiosity as opposed to, I think I have the right answer, I think would be very helpful.
I will echo Kyle that my stuttering changes. My stuttering is variable. I was also fortunate that I had really good supervisors in my graduate program. My graduate program was very supportive. One experience that comes to mind is when I was on an external placement and I was giving the self. The self is the clinical examination of language fundamentals. Most SLPs know the self. So I was doing a subtest. The subtest was called recalling sentences. So you read the sentence and then the child has to repeat the sentence after you exactly as you read it. So I was doing that subtest, and my supervisor came up behind me and then just started reading the sentences. So I think I had read maybe like 2 or 3 sentences, and then she came up behind me and she started to finish the subtest for me. And then she said, I think your disfluencies are throwing the client off. And so she wrote in my evaluation that I needed to be mindful of my disfluencies and how my disfluencies might be impacting the client. I didn't really sense that for myself, but I just thought, okay, like I guess I have to. And she said, and you've done it before, meaning that you've been fluent before, so I know you can do it again. So you really need to just be mindful of your disfluency. So at the time, I was a graduate student, so I wasn't thinking. My thought was, all right, well, I guess when I get to that portion of the self, I just need to really focus and really concentrate and really try my best to not stutter because that was kind of where I was then. But interestingly, when I was a clinician and I would give that portion of the self and I would sometimes stutter on some of the words, like the kids just repeated the sentence back. Like it didn't throw them off. They didn't repeat my stuttering. They just repeated the sentence. So it really, I felt like had no impact, but that's an experience that comes to mind. But it's just that thought, well, I know you did it before, so you can do it again. But that's just my stuttering. My stuttering is going to change from day to day. It's just variable. So I guess that's how I would answer that, is that stuttering is variable. It changes.
Yeah, and to go off of Derek, I think for me to add, I wish my clinical supervisors would have had a nuanced knowledge and understanding of stuttering. And I know I was in grad school 20 years ago, and thank goodness we've come a long way. And I think all those individuals were going off what they knew at the time. And so, but and the fact that maybe picking up on all my avoidance behaviors might be indicating a lot of struggle, right? Or just even asking me, you know, like everyone's saying, that curiosity stance. Tell me more about your experience. I think that would have been really helpful instead of just looking at me through the lens of fluency only and fixing, and that I needed to fix that so then I could be a really good clinician. As far as to recommend brushing up on my fluency, shaping skills, so maybe instead of that, I really would have benefited from more of a holistic view of me as a human and a neurodiverse human and someone with very, some great strengths as well as challenges, and having a safe space to talk about that. And I think another layer would have been really helpful for them to be desensitized to stuttering themselves. So yeah, just to start there.
I think to go off of that, I think just understanding that fluency strategies, one, don't always work out, but two, sometimes people who stutter don't like to use them. I had a supervisor who it was like this whole project thing where I had to talk about a report with a parent. And obviously I was a little bit anxious. And so I stuttered a little bit more. And on the rubric, the professor said that I did great, but when I'd get nervous, I should try to use more like strategies and stuff. And so it was really hard to hear that like content wise, I did great, but then, it wasn't as, great because of the way that I talk. So I think just really having everyone kind of be on the same page that, as you guys were all saying too, like stuttering is not something that's constant. It's going to change. And that, strategies aren't something that we can always like rely on.
To piggyback off of a couple things y'all have been saying. One is, Kyle brought this up right away about like having a curiosity towards stuttering. When I think about my clinical placements that went really, really well, it wasn't necessarily that the supervisor knew anything about stuttering. It was that they were open and asked me questions about it and listened and had suggestions, and they weren't authoritarian about what I should do, but it was a collaborative process of figuring out how to make this experience as good as possible. Whereas my placements that were the hardest, it wasn't because the supervisor was a bully, but like we just didn't talk about stuttering at all. And that created an environment in which I felt very uncomfortable stuttering. And so I stuttered up a storm and was constantly wondering what my supervisor was thinking about it. And so that openness, I think, is almost more important than a priori knowledge, right? Just because I think they can learn on the job from us. And we can learn from them also, right? Like we're students. Oftentimes we don't always know the best way to handle our stuttering. And so through those conversations, we can come to often better conclusions than we would have come to in a room. The other thing I'd like to piggyback off of is like, we've been talking about like stuttering's variability, that it changes. And I think, at least for us as clinicians, as people who are working with other stutterers to make progress in stuttering, part of that variability is hopefully progressive over time, right? That like we're learning to handle our stuttering in healthier and healthier ways. But that the point of graduate school is not therapy for my stutter, right? That you're teaching me how to be a good clinician, but that you do not need to teach me how to stutter better, right? That is beyond graduate school, right? That's something that I'm working on, we're all working on, right? But that Lauren was just talking about being graded for her stuttering, that feels entirely inappropriate because that's not what you're there for, right? It's not therapy for you, it's school. And so to just trust that, just like we believe our clients make progress, right? Trust that like, this is all happening in the background, right? Like we're all trying to cope with our stuttering in healthier ways, but that like the program doesn't need to do that for us.
Yeah, sorry. Can I piggyback on that, Chris? Because that's the exact experience I had in my graduate program. That was yeah, like you're explaining it, I think I'm just having that realization. I mean, they were telling me I need to be in therapy. I needed to fix my stutter to be a speech therapist. Um, yeah, thank you for sharing that.
Yeah, kind of on that, I was listening to all of y'all and thinking about my own experience, and I was fortunate to have really positive experiences. And I think that was a mixture of kind of my own kind of different factors I was bringing to the table and supervisors that I had and different things. But I thinking about, stuttering being different, it changes for each person, but every person who stutters is different. And so I was fortunate that I had positive experiences for various reasons, but I remember then a few years later working for the university that I went to graduate school at, and there was another student who stuttered, and he happened to have had blocks that were a lot longer than mine. And there was a whole faculty meeting, a meeting about what are we going to do about this? And people were like, well, Jack, you managed to like they were basically kind of assuming things about my stuttering that wasn't accurate in terms of how I experienced it. You were able to control things. So what? And I was in a very uncomfortable position of having to like answer for this person's speech and like explain how I navigated my own communication as a totally different human being this person was. And this kind of like, what are we going to do about this? And it was such a problem-oriented way of thinking about it because it was different how he was communicating as opposed to the fact that and that kind of led me thinking about like Chris said, like we're students, we're learning how to be we as grad students are learning how to do the job. And so if as a grad student clinician, I would always think, well, what do I want them to be able to do at the end of this semester, right? My focus is on clinical problem solving, treatment planning, taking information and synthesizing it into decisions, figuring out the next steps, how to engage with the client, building rapport. Okay, great. Those are my things. Can you do the job and make strides in all these things? Great. In your own way, how are you making progress and growth in these categories? None of those are not stuttering. Um, and so thinking of kind of remembering like, well, what's the job they're trying to do, and what are the areas of growth we want to see them grow in as a student clinician, right? Not as a full-fledged, employee or not as something else. And thinking, okay, well, let me make sure I'm focusing on the actual skills that I want them to be able to do and that I want to see growth out of. And then with curiosity and with relationship building, figure out how we can work with what they're working with, right? If they're struggling, they're struggling. I want to be there to help them. And not as like a person who's like, you have to get better at this one thing when I need to be focusing on supporting them as a growing clinician. Um, so that's what I think about a lot of times. Sometimes stuttering can distract us from what's the actual job we're trying to do. And am I meeting those goals or am I not? And if I'm not, okay, great. Then we have things to work on. But if I'm showing these things that are positive strides, then great. I'm working towards the job of what I'm trying to do.
Thank you. Um, the point that you made about the student with lots of blocks just leads us right into the next question that I wanted to ask. During your clinical training, did you experience periods of increased physical tension or secondary behaviors or avoidance behaviors, communication apprehension, just during your clinical placements? And if yes, what did that look like for you, and what helped you move through those challenges the most?
I'll start. For me, it primarily manifested as now I understand. I was covert. I was a covert stutterer, so it was a lot of avoidance, a lot of Derek. I loved how you shared their story about the self. A lot of practicing the self sentences, recalling sentences, so I could get my fluency. So I just really was on my own with that. I was just finding my way. And so going back to what I shared earlier, the message from my clinical supervisors was, you got to fix the stutter first, you know? So it was just continuing to avoid and fluency shape my way as much as I could, as hard as I could. But I feel like there was this tension with this inauthenticity during that, though, as well. There was just a lot of energy going towards the seeking fluency piece versus my clinical skills growing. And so it was met with trying to grow as a clinician and you know, and then handling the challenges of my stuttering by myself. And I just don't think I was held. I didn't have relational, I mean, I had some, you know, I had some very nice, lovely clinical supervisors, but I don't know, it was a different time. I just think it was the power dynamics are very real, and I just felt like I was doing it on my own just to get through. And I don't really remember. I think it was just survival a lot for me in my graduate school experience, truly. And just, but I remember, if I could, you know, I think a lot I'm overwhelmed with it. It's the memories is just I made my way. I was able to be fluent enough, and avoidance was the way though to get through to the other side, I guess, is what I'm remembering. Yeah, and wishing that someone else could have seen me, you know. So
I think to go off of that, I just want to like preface that my grad school was awesome. It was a tiny school, but the program was like intense. And I think when you have a person who stutters along with being in grad school, like that's tough. It's hard. I feel like grad school as it is a lot of work, and it takes up a lot of your time. Um, so it's hard to kind of separate them in a way. I felt like I was constantly like trying to like use grad school as almost as like a test. Like, is this actually where I'm supposed to be, and is it actually okay to be a person who stutters and a, a, a SLP? So it definitely was a little bit like challenging. I also think at that point in my like stuttering j- 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 journey, I was at a very low point. I feel like everything was kind of coming to like a head almost in a way, because grad school really pushed me to kind of own it. Um, and yeah, I just feel like, I don't know, it was a tough time for sure. And kind of like as Mandy said, having to kind of read everything out loud and just like constantly like practicing. It got to a point where I was like, no, like instead of me trying to help out other people, like I also need to kind of reach out for he- help. So yeah, kind of like what I was saying. It was kind of like a test. But yeah.
This story has potential to be really long, so I'm gonna do my best to keep it short. Uh, Ana Paula asked, what was your stuttering like when you were struggling, and what helped? And like a lot of you, you know, it sounds like most of you did have pretty positive experiences in graduate school. I did also. Um, that didn't make it completely easy, right? It was still very difficult. But my first semester, I was at the University of Pittsburgh, and Pitt doesn't have an in-house clinic, and so we were immediately out in the community, and I was at a hospital doing inpatient swallow evaluations, so like feeding people crackers and applesauce and like feeling their neck and seeing if they coughed, kind of a thing. And I'm gonna name names because this is a really positive story. My supervisor was Dr. Jim Coyle, who's a dysphagia specialist. And my stuttering was probably about as struggled as it got. I would sort of walk into a patient's room, and just block and block and block and block and block. It would look kind of like, I would also stare up at the ceiling. So it would look kind of like, hi, my name is, my name is, hi, my name is, um, um, my name is, my name is Chris. And it would just kind of go on and on like that. And it was exhausting, and there'd be a puddle of sweat on the floor. And one day, Dr. Coyle pulled me aside. And so that was what my stuttering was like, to answer the first part of Ana Paula's question. The second part was what helped. And what helped was Dr. Coyle pulled me aside like a few weeks into this and said, Chris, it seems like you're having a really hard time. And I said, yes, I'm having a very hard time. And he said, I don't know much about stuttering. Swallowing is my area. What do you think we can do about this? And I said, this is how I talk. Like trust me, if I could be doing something differently, this would not be my choice, right? Like I would be. And he kind of sat with that for a moment. And he said, I've noticed that when you look at his modus operandi, he would always kind of hang back by the door, by the entrance to the patient's room and just watch me. And so he was never like at the bedside with me. And he said, I noticed that when you look at the ceiling, your patients always look up at the ceiling too. They don't know why you're looking at the ceiling. A lot of them are kind of disoriented. They just had strokes or been in car accidents, had TBIs. It might go a long way for them to be able to stay with you, like through your blocks, if you keep making eye contact. Do you think you could do that? And in my head, looking at the ceiling was like neurologically part of stuff. Like it's just what happened when I hit a block. My eyes went up and I looked at the ceiling. So like in my head, I was like, no, like if I stutter, my eyes go up. Like I can't do that. But I said, you know what, maybe like I can try that. We can try to work on that. And so my goal for that whole semester was to make eye contact. And so like for 4 months, like that's what I worked on. And over the course of that 4 months, like lo and behold, I could make eye contact. It was this really gradual process. Right? Like my eyes would go up and I'd say, oh yeah, Dr. Clell wants me to make eye contact. And I could like yank him back down. Maybe like a couple weeks later, I could like yank them back down a little bit faster. A little bit later, I could catch them on their way up, right? Before they got to the top. And then I could start catching them lower and lower and lower. Eventually, they kind of wanted to go up, but like I wouldn't let them. By the end of the semester, I wasn't doing a thing, right? I was just talking and making eye contact. And it was like, holy smokes, like I didn't need to look at the ceiling, right? Like that actually wasn't part of my study. That was just something I was doing. And that like started me on this whole journey of like, what is my stuttering? Like what is actually part of it? What is necessary with what I'm doing and what isn't? And so every semester I just pick like a little thing. Like I've got a whole semester to work on this one thing. Like I was blocking once, like, can I make a noise? Any noise. Can like so now I'm in January, right? By June, can I be making noises while I'm stuttering? Right. So by June now, instead of blocking, I'm like making weird noises. I'm going like So all right. Well, I can make that noise. Can I make the noise? Can I make the sound of the word I'm trying to stutter on? Right. So like maybe by August, instead of saying I'll say like like, right? I'll stutter on the L. And so like I just kept it was really empowering, is what I'm trying to say. That to realize these little things that I thought were neurologically hardwired, were part of my stutter, turned out to not be. And to discover that with the help of a supervisor who actually didn't know anything about stuttering, at least claimed not to. Maybe this was all part of his secret plan. But all he did was listen and ask open-ended questions, right? And encourage my own curiosity. And that was probably the single most empowering experience of my life, right? To like realize that I have choices and I have options here.
That's such a beautiful, beautiful story, Chris.
I don't think I was successful in making it short. So
No, I loved it. I love so many aspects of it. So I wanted to jump in because there's something within that I was thinking about also earlier in the questions, and I love that you were given the freedom to do that. You know what I mean? Like this is like if we're speaking to graduate supervisors in this panel, right? Is that like we said earlier, like these are students who are learning how to do this, right? And I think the best supervisors any of us probably had gave us freedom to fail. And I want to be clear when I'm saying fail, I don't mean stutter, right? Because stuttering when you're doing something is not the failure, but freedom to try something, freedom to fall flat, freedom to go. And I never got into neurogenic stuff, but I had a supervisor when I was at a rehab center who was like, well, it's not open heart surgery. You're not going to kill him. Give it a try, you know? And sometimes I tried this activity with a group and it was a complete failure. And she's like, well, we learned something from that. And I kind of laughed. And like, I had supervisors who was like, that didn't work. And it's like, well, okay. Well, now I don't want to try anything. You know, and I'm so locked up and inhibited, and not even about stuttering, it's just about making a choice. And I love that you were given that very succinct goal of just like, let me try and experiment, but that you were given the space to do that. It wasn't like, well, you got to get this right now because we're doing this swallow study and you have to get it better, you know? Um, there's obviously were standards of care and of instruction, but your supervisor recognized that you're a student working through how to do this, and you were given the space to have those to make those small adjustments. And at the end of that semester, it wasn't like you had grown in lots of different ways. And so I think that that's such an important thing is to broadly give your graduate students freedom to just try things and freedom to fail, but within that recognize that like perfection isn't the goal, it's growth.
If I could just add one thing, Chris, you brought up a person who has helped perhaps allowing, yeah, some space for you to begin to go within to come to these realizations of how you could grow is how I was hearing that. And I was thinking, yeah, like Dr. Glenn Tellis at Misericordia, where I went to grad school, is the department chair there. And through our relationship over time, he really helped me navigate challenging situations that would come up in clinic, particularly related to physical tension around my stuttering. With introductions, I mean, those were so difficult. You know, be hi, and just nothing coming out. And I think that also reading standardized tests was a really big challenge because I couldn't change words. And I just remember the amount of tension I was experiencing, you know, to be so difficult. So what was it that helped? It was a couple pieces of this. I had a person in my life at that time who I knew I could go to talk to. And I'm thinking, you know, perhaps as a supervisor, part of, you know, the supervisor grad student relationship, that when there's a space created where a person can come to you and feel that they could talk with you about what they're experiencing. Hey, I'm noticing this. This is how I feel about this, and I don't really know what to do about it. You don't have to have the answers, you know, to give them at that moment, and you could be with them in that moment and explore together what are your choices that you could do, and, you know, ask the question, how can I support you what do you think would be helpful of how I can support you? You know, creating space at the table to have those discussions for me with my supervisors was the single most helpful thing because I knew that I could talk about it. And I would just add quickly that the other component was I was in therapy at the clinic that I went to school at because I chose to, not because I was told I had to do that, and I had really positive experiences. And so I was working on, um, you know, like dampening stress responses around stuttering in different situations and like choosing to work on my communication, choosing to let myself stutter. Um, I found it allowed me to be more present with clients, but this happened bit by bit over time. And I think that it'd be helpful for supervisors to know, um, that that a person is on their journey and there's things that they may be choosing to do to help themselves grow, and that you could talk about that with them. And I mean, it could make a huge difference. And yeah, I think I I personally know that if I wasn't going to therapy at that clinic that I chose to, I don't know how I would have done it. And it also helped me be able to talk about stuttering, as the student who stutters, to bring it to the table in ways that I never even thought I could talk about it in that way. Um, yeah, I was just blessed to be around good people, that understood stuttering and that were helpful, like Dr. Tellis was.
Listening to y'all reminds me of something that Mandy said earlier about the supervisors being desensitized, stuttering, right? Because we're talking about creating the space, having a sense of curiosity, giving the student room to stutter and room to play with their stuttering. But they can really only do that if they themselves can tolerate stuttering, right? That for a lot of supervisors, that's probably really hard. Maybe to recognize in the same way, if you were doing therapy with a person who stutters, that like the difference between hard and impossible is 1,000 miles wide, right? That like just because you're feeling uncomfortable with stuttering doesn't mean the problem is the stuttering, right? That like maybe that requires some patience and mindfulness on their part, and for them to be able to recognize that. I'm not saying immediately they'll just be cool with stuttering, but that they can sit with that tension, and it will go down over time.
Yeah, Chris, I love how you say that, because then that lends for this beautiful foundation in relationship and holding space for relational energy, right? If I'm regulated, I almost look at desensitization as a regulation tool for speech therapists around stuttering. It's very helpful to be regulated themselves, supervisors themselves, whether they may need to come to the table or actually take time for self-care, make sure that they're taking care of themselves, outside of stuttering, right? Outside of being comfortable stuttering, just, being around young adults and, very intense program themselves helping. So I see kind of a full circle moment here, how that kind of lends to a greater message of relationship, regulation, yeah, and then leading to reasoning, being able to, yeah, share in that space safely.
Can I ask a question? Sorry, Ana Paula, if it's not kosher. That's kind of tangent related to what we're talking about, but looking at the context also is, so we've talked a lot about, and understandably so, around the supervisor's, right, perspective and their being desensitized to it and recognizing what's the goal and what's not a problem. I'm curious what experiences y'all had with regards to how your supervisor handled client or patient's reactions to your stuttering, right? So you're walking into the clinic, Chris, you gave that description of big blockages and backing up. It isn't just you and your supervisor in the room. There's a person sitting there And sometimes they're not the one who's patient. And sometimes, you know, that's difficult. And in my, to speak to my own context, I know different student clinics are different. I was a full-time outpatient clinician, and we happened to be connected to a grad program. So I was the clinician, and part of the job you knew was supervise students. So a student would come in 2 times a week for a semester, and they would jump in with people who I had already had relationships with potentially, right? So for me, it was this weird sense of like, well, my responsibility is as a speech pathologist to my patient, but I'm also a teacher, and I would try and triangulate between being like, sometimes, okay, am I being too protective of I'm being protective of my client's progress, but when can I let my student fail a bit, knowing that it's not going to cause detriment to this person, but also recognizing that if a parent or a client has a problem, I need to have my students back right now. And not go to the client and go, I know, I'm sorry, it's really hard, but you know, they're working through it, right? And like making sure that they know I have their back. And that's difficult, and it's not always the case. And so I'm curious what experiences y'all have had or thoughts on that idea of when it's the client or the kid or the family, they're the ones raising concerns around that.
I have one if I could hop in really briefly. Thank you, Jack. I was hoping this would come up. Quick story. Um, through the relationship that he and I had, I remember being at the clinic at Misericordia. It was me and Dr. Tellis, and him asking hard-hitting questions. It was, and I'm just giving it from my personal story that was so helpful of, okay, let's think about this, Kyle. What do you think might be potential challenging situations that could come up? And we made a list. And then what are you going to do about it? And what would you like me to do about it? So not just assuming that's what I would want, but asking what could we do to problem solve this together? An example was so potentially, what are you going to do if a parent comes to you and says, I don't really feel comfortable having my child work with you because of your stuttering? And again, we had that relationship where at that moment in time, he could ask that question and it was helpful for me to think about it. And I was like, I don't know. Like, what am I going to do? Like, what? How am I going to navigate that? And the point was, it was proactively thinking about how, what am I going to do? And what do I want my supervisor to do that's helpful? And that situation didn't arise at the university clinic, but it did in my clinical fellowship year. And um, I think that though, so what can you do as a supervisor, is thinking around what may be potential, situations that arise. What can you do about it? That would be helpful. And then how could I have your back? What do you want me to do? And that was just beyond helpful when he did that. And it was a hard hitter. It was like, man, that's gonna suck if that happens. Yet it's the reality of the world that we live in. At times we can't control what a mom and dad might ask. Um, so yeah.
Anyone else? Well, that does lead us to another question, I think that's related. I know that many of you disclose that you stutter in different situations. How did you make disclosure decisions during your clinical placements? And what role can or should supervisors have in supporting students through those decisions?
I disclosed right off the bat, not right off the bat. Once I was in the clinic and realizing how hard this was, I relied heavily on disclosure. every time I was introducing myself to a new client. I think that a supervisor, as we've been talking about, I think things need to be presented as options, as choices, not as demands. But that, I know a lot of people who stutter might not even have thought about disclosing or used it before. And so to be able to offer that as a potential option, to be able to talk about it with your student who stutters, to make it a possibility for them, I think could be really powerful. Part of me wants to say, part of me wants to be like, if your student is really struggling stuttering, they really should disclose, right? Like that seems to me to be almost guaranteed to be helpful. But if they feel forced to do it, it's not going to help, right? If they feel forced to do it, they're going to be stressed out while they're doing it. They're going to be resentful of the activity. They're not going to see it as empowering. They're going to see it as humiliating, right? And so even though we know how powerful it can be, you can't force it on anybody. Its power comes from the choice, right? Of saying I could have tried to test my luck and come off as a fluent person here, but I chose to show that I was a person who stutters, and I think that's where the power is. And they can't do that if they're forced to do it.
Yeah, I think for me, I I was in grad school. This was the early 2000s, so I wasn't thinking in the mindset of disclosure and open stuttering and you know having identity as a person who stutters. It was a lot of concealment for me. So I think, whenever I would have to go over a clinical report with a parent, or if I was, as a CFY in an IEP meeting, you've got the parents there, you've got the principal or assistant principal there, you've got like all these people around the table, and I'm going through, and I didn't want to look like, I don't know, I just didn't know, like, I was afraid of judgment. So I was concealing quite a bit. Um, when I was in those situations, which caused lots of anxiety. I mean, now I disclose all the time. In fact, now I even throw in some voluntary stutters because I feel like I'm not stuttering enough. So now I do it all the time. But I think then I just wasn't doing it. But just listening to the discussion that everyone has been talking about, I think the relationship, the curiosity, and having open discussions are very important for clinical supervisors. Um, I feel like clinical supervisors should be supportive. You should be, it's important to be supportive of your student. It's important to be there and, have those open discussions. Like if I know that my supervisor is going to be judging me for my stuttering, it's going to really impact how I approach my clinical interactions. So, like in the previous example, like I've never personally had a parent or like a client like say something about it, but let's say that did happen. Like I would want to know that I had a supervisor who was supportive of me and someone who was going to, have my back and that I wasn't going to get in trouble. So I think that curiosity and that support and those open discussions are important for supervisors to keep in mind when you're interacting with your students. There's so many people who stutter in the profession who do really good clinical work. So sometimes I just worry about students who stutter, who don't have support, who don't have supportive supervisors, or who may think that they can't do it and they either turn to something else or we lose them, like I'm sure that probably happens. So, which is why I'm glad we're doing this. So that support, that curiosity, I think is very, very important to just kind of be with your students who stutter. Um, yeah.
Yeah, I think it's a show don't tell thing in some ways.
Mm,
It can be,
that's
especially if
good.
you're a supervisor who doesn't stutter, because
Hmm.
it's like, um, and this came up when I had some NSA guests visit my class at Austin P, and they're sharing their stories, and one of the young men said, it's not a big deal. Stuttering isn't a big of a deal. And I was like, hang on, no one in this class also stutters. So if you just said to your client, it's not a big deal to stutter, they're going to be like, what are you even talking about? But make it not a big deal, right? Show that it's okay to stutter. When in some of our clinical work, I'm sure people have said the same thing. I'll be like, you might not think that it's okay to stutter yet, but when you're with me, it's okay to stutter, and I'm going to act like it's okay to stutter. And I think that kind of thing of like model it and because you can say all the platitudes in the first session you want. It's okay, take your time, it's going to be fine, whatever. But then if you're acting like you got to hurry this up, you need to do this, like then that's what the proof is in the pudding there. So it's thinking about how you're acting in terms of showing that it's okay and that you have their back, instead of like backing up whatever you might be saying at the beginning of the semester with how you're acting throughout the semester.
Yeah. And something Chris said earlier kind of stuck with me. It was about is it really the supervisor's discomfort, or maybe they it's about maybe the desensitization of the supervisor or something to that effect. Because the kids I worked with didn't have a problem. Like none of my kids on my caseload never had a problem with my stuttering when I would stutter. They were, I mean, I can't recall a time when, I was at an elementary school and a high school. I can't recall a time where any of them ever had a problem, ever had an issue with it, because I don't really think they thought about it or they cared much about my stuttering when I would work with them. So um, I think the discomfort and the desensitization with the supervisor, maybe that's something that maybe needs to possibly be addressed. But that just kind of stuck with me when we were talking about, you know, um, is it really my stuttering that's the problem, or is it the discomfort with the supervisor towards stuttering? But I know that supervisors have this question, and I don't know that I have the answer really, but I'm sure supervisors wonder, this person who stutters is going to work with the family, and what's the family going to think, or what's the client going to think, or what if the family says something, how do I respond? I think that question probably comes up a lot in clinical interactions.
Well, I'll just do a follow-up to that, because I think I'm going to call this the $1 million question, just in the sense that, um, around all of these things that we've talked about, all of these clinical tasks or expectations, right? Um, Basically, we're asking students, whether they stutter or not, right? We have some pretty high demands in the sense of time pressure. It's a fast-paced environment, right? There's a higher overall speaking load, and the performance pressure is always intensified, right? And this is regardless. And then of course you add stuttering to it, and it makes it maybe even more intensified, right? And so the question that we get asked is, okay, well, what do I do, right? Because they feel the pressure to instruct or to guide or to somehow minimize that impact that maybe they're feeling for their student, right? Because they see maybe struggle or they see the challenge. And so if you were to answer, what do I do in those moments, or what do I say, right? And I do know, I mean, a lot of you have already said, right? Listening, brainstorming together, co-creating solutions, all of those things. But if you had even maybe more tangible actions, are there more tangible actions that you would recommend in preparation for these challenging situations?
I mean, I think if we go back, relationship, curiosity, right? Those are the big ones. I think that's the foundation at approaching any child, any student that way, with relationship first, the discovery, right? So, or curiosity helps me learn about I keep saying client, sorry guys, student, the graduate student. But I think even beyond that, to help with the relationship and the curiosity is the supervisor's connection to the stuttering community themselves, their awareness and knowledge of neurodiversity. I just think it goes deeper. I think there's something that um, it calls for that discovery in those communities. So yeah, I don't know. I thought about that last night when I was answering, and I just think it, yes, you can have, without going down a deep dive, yes, you can work on being more relational and regulated and curious and all that. But I think to help to see your students and other people, or just to know that wow, it is common for people who stutter to become speech therapists, right? This is something that is very common. So why not go to the people who stutter, and hearing their lived experience and learning, and just that adds to offering choice. Maybe that the graduate student doesn't even know that they have, speaking to Kyle, speaking to Chris, speaking to Derek. You know what? You may. And I know I don't want to lend this to therapeutic space that we're holding, like planting seeds, but I think a clinical supervisor could be that alliance with a graduate student. I mean, I wish I had that alliance at the time. And I think now, as a clinical supervisor myself, I've worked hard to be an ally to them, and looking at them as a whole person and trying to understand. I draw parallels. I work with students with anxiety and ADD, and I took that on myself to learn more about those things myself, so I could just be more knowledgeable and get them, if I ask how they're doing and they're sharing their struggle related to their neurodiversity and their experience. I can say, well, hey, have you ever heard of this support group? Or I don't know, getting them in touch with other people. I think it's just really, it could be really helpful. And I think for me, when I think back to Amanda in grad school, there's so much I didn't know about my own stuttering experience, obviously, and I think it just would have been so beautiful if someone would have had those seeds, had those little glimmers outside of the safe relationship, but just put me in touch with another person who stutters, told me about friends in NSA and during that period, so then I could meet myself with more kindness and love and curiosity myself, to then face the challenges and the rigor of grad school itself, instead of further affirming the stigma and struggle around my stuttering. Yeah.
After you, Jack.
I was gonna say I had a supervisor who kept reminding me to have fun over the weekend. Um, and thinking about like people come to grad school different times, but I would venture a guess that the majority of graduate clinicians are in their early 20s, recently out of undergrad, right? And they're very stressed. They're very like, I'm trying to get all of this. And it's like, where do you find joy and what do you find confidence in outside of this? Make sure you can tap into that. This can be hard and you can get kind of beaten down sometimes. And it's like, you know, oh, you like rock climbing? Make sure you go rock climbing a few times this semester too. Or, what are the things that give you confidence, broadly speaking? Make sure you're doing that. Because, their professors in their class can be like, this is the homework, these are the lectures, blah, 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 blah. And you're there and there's quiet moments. I think what's really lovely about supervising graduate clinicians is that there are opportunities to be like, okay, we're sitting down at my desk and someone didn't show up for their session and we have 30 minutes to talk as people. And sometimes I saw clinicians who I work with who would be kind of like they would be on their computer and the student would be just kind of sitting there on their own thing. And it's like I was sometimes if I was tired or stressed out, I was like, I have to entertain this person. But usually I'm like, so, and I was just like, I want to learn about you, person, and learn about, build that relationship, and like that was beneficial. I hopefully to establishing just that freedom that they felt, and also that, so that they can learning how they can reminding them that they're a person who's allowed to have fun and who's allowed to connect with the things that give them confidence in a greater things. Usually the things that gave me confidence as a clinician weren't necessarily speech pathology related things. They were things I did with regards to theater, with regards to my friends, or other things that then bled over into me recognizing that, hey, that can influence how I do my job also. And so helping them recognize that they don't have to cloister themselves off for the next 2.5 years. Um, and that's actually not going to do them any favors.
I echo that, Jack, that yeah, I mean that foundation of a relationship there is and in my experience has just really been helpful. I think no matter how proactive you might be in talking with the student about what the student could do in, X, Y, or Z situation, or what they want you to do, there may be a situation that arises that is just highly unexpected. And it- I think that you don't need to know all the answers as the supervisor. Um, and the person who stutters, that student might not know, the answers in that or what's best in that situation. And that's okay. That's the reality sometimes of navigating this world as a person who stutters. And I think though what's really important is that there could be a reactive discussion and dialogue to talk about it and to process it with the student. And I know that there can be, I've heard stories, I haven't really experienced this personally, but where there's some pretty, you know, um, traumatic situations for grad student clinicians who stutter that happen, in a clinical environment. And to be able to talk about it with them after can just be a real gift for that student to process what just happened. And it's okay if you don't have the answers and you could be with them. Um, and I just wanted to make that point. You don't need to have it all figured out. It's okay to come into a situation like, I want you to know I'm here for you and however it is that I can support you. And um, I'm glad that we can talk about it and, create a new plan if that's needed.
I have one last question, and I'm going to let Chris chime in first because I know that you're going to need to exit here in a bit. I'm just going to state for clinical supervisors just some thoughts about what students may be feeling uneasy about in their clinical placements in terms of just the vulnerability that they feel in grad school potentially. And then I'm just going to ask just for you all to comment. So students may feel uneasy because they don't want to appear incapable, because they're unsure if accommodations are appropriate, because they fear that it may affect their evaluation, like some of you have already mentioned, because they're still figuring out their own speech patterns and their own experiences. They're unsure how to have open dialogue about their challenges, and they're concerned about professional credibility. So what any thoughts or comments just related to this vulnerability that is present? And I would say it's not just students who stutter, but I would say more intensified for potentially students who stutter. So what would you say about, just what helped you feel safe being vulnerable, or any other thoughts related to vulnerability?
I'm going to steal something that Jack said earlier, which was that like the supervisor can model this for the client. And I think in my story with Dr. Coyle and Kyle's story with Dr. Tellis, right? Like they actually opened the door for that dialogue. They modeled how to approach a topic in a sensitive way, in an open-ended way that wasn't prescriptive. And something that I tell all my students in my counseling class, that I don't know that they believe me, but that there's actually a tremendous amount of freedom in not having the answer, right? Like, you don't need to enter these conversations knowing what your student should do, right? That you just need to let your student know that it's okay to have these conversations. Like Kyle said, brainstorm some challenges that might occur, or in my case, just pointing out something that you have noticed about how I'm reacting and how that impacts my clients, right? And what can we do about it? Right? That again, to steal something Jack has been saying, most frequently these are early 20-year-olds, right? And so they're not the most equipped people to have vulnerable conversations. And so I think the supervisors likely are hopefully more mature than the students are. And so I think by just giving them permission to be vulnerable, by being vulnerable first, can go a long way.
Thank
Yeah.
you.
Yeah, that's great. We had a 1 day it was a 1 day NSA conference in Michigan, and at the end, I went up to do the open mic, and told the audience, I get really nervous when I have to speak before groups. And I had a couple of students who were there, and they're like, "Really? Like, you get?" I said, "Yeah. Like, believe it or not, like before class, I'm in my office." And I'm like having a moment, like I have to get into the zone. I'm doing some mindfulness every single time before I walk in the class. I get nervous. Like, to me, that was kind of demonstrating vulnerability. So I like to normalize vulnerability. I've worked with clients who come, who are med school students, and who's students from allied health programs, and they all talk about time pressure and, having to get things out in like a certain amount of time, or they talk about supervisors. They talk about all kinds of things, but one of the things that we talk about is vulnerability and how to normalize vulnerability, and it's okay to be vulnerable. And I don't necessarily know if they know that or if they've thought about that as an idea, but that vulnerability is okay. So some of the most some of the interactions I've really appreciated the most were when supervisors would tell me a story about maybe like when they were in grad school, even like now as a seasoned clinician, when they've done things in therapy that didn't go well. That makes me feel better as a student. So I think, like what Chris was saying, when you model vulnerability, then I think it really has an impact on the student. It did for me.
Absolutely. And I think the there's several things that I think modeling vulnerability, especially vulnerability around like, the actual job, can help also re-center the focus of like, you're here to learn how to be a better clinician, and these are the skills that go into that, and it's not about how little you stutter. And so I'm refocusing us on that by being vulnerable about my own skills. And this is something I struggled with when I worked previously at my previous job. I didn't just see people who stuttered. I also saw, 3-year-old kids who were on the spectrum who were nonverbal working on, and I couldn't tell you how insecure I was about doing that. And I struggled for a while about being like, I got to make sure that I'm the expert because these grad students are going to sniff out that I don't really know half of what I'm doing. And then I'm like, why? They don't know what they're doing. Let's figure out together. And let me ask the question of like, what do you think we should do next? I'm curious. And making sure that I was not like pop quiz hotshot. What should we do next? Wrong. But genuinely like, let's think about this. Here's what I'm thinking, and I'm going to think out loud. And I'm talking out loud. I'm thinking, what do you think about that? And we like in modeling the vulnerability of me being like, I don't have the whole thing planned out already. figuring it out. And you're in on this. Let's figure it out together because I'm modeling both the skill of clinical problem solving and also being vulnerable about the fact that I don't have all the answers. And I think that could also shift the focus back to what they're there for, which is about being student clinicians. So
Yeah, I love this, how we're all coming. Oh, Chris left. Like, sorry. How this
he
is
was
all
raising his hand at first. Then I remembered that he was leaving. Sorry. So I paused myself way quickly.
Yeah, and how I love this, how we landed on vulnerability because that's the doorway to relationship, right? And intimacy. I was going to Chris talking about his beautiful speak about stuttering, and when we are vulnerable, it opens up the door for someone else to lean in. And then what a beautiful clinical skill that we're modeling for them, right? How beautiful that that empowers them to take that into the therapeutic setting. So I think that's just a really credible full circle way of, yeah, that's where it all starts with. And yeah, I had something else, but I lost it.
I'm a terrible poker and chess player, partially because I can't keep things inside. And I've started to use that as a skill of vulnerability because I'm like, okay, so here's what I'm thinking about right now. And I'll even do it with clients, not that this is the focus of this, where I'm like, so I'm thinking about this and I'm wondering if these two directions. What do you think? And it's not it's me being vulnerable, but also thinking it out loud. And I think as a clinical supervisor, being open about that like I'm asking you to try and figure out these plans. I am too. Let's do it together.
I think we also need to normalize this idea of supports. Like, that's not a bad thing. I mean, everybody uses supports. We just don't think we do. Like, sometimes students or supervisors may write down everything they want to say in a session. Sometimes it's all in your head. Like, sometimes you have notes. Like, everybody makes use of accommodations if you think about it. Like, no one really does anything completely independently. So I think it's very appropriate. Like, some support just looks different for everybody, and what supports like Jack requires may be different than what Mandy requires. So, I think it's just I think the question is what types of supports are going to be helpful to you, rather than if you need support or if you don't need support. So I think that's kind of how I would reframe the question, because we all use accommodations to some degree, you know. So
Yeah, to add that, I think another word that's coming up is normalize struggle. Normalize that there is struggle. People are struggling all the time, and it's okay to struggle, and there's someone that's going to be there for you to help you through that. So I love that, Derek, to add that, like to normalize support and normalize struggle. None of us have the answers. The clinical supervisors, they don't have all the answers either. Just like we're saying, it's okay not to have the answer. So normalize struggle for the clinical supervisor and find help, normalize struggle for the graduate clinician, and have this community of help and support. Yeah, it's a nice little visual, isn't it, you guys?
Yeah, off of that, Mandy, I just had this thought in my mind that, to have the back of, a grad student who stutters, to have their back doesn't mean that you're protecting them. And I think that there's a difference and a distinction that um, it's not that you have to protect them from experiencing unpleasant emotions, right? It's that you can be with them to talk with them, to help them process it, to, problem solve in an open way. Um, Much like as a clinician, it's not our job to protect clients from experiencing unpleasant emotion, but how are we helping them relate to it and deal with that in healthier ways? But um, I think, yeah, I just wanted to make that distinction. If that does that make sense to everybody?
Absolutely. It's like the metaphor of the lawnmower parent, where it's like, I'm going to pave the whole trail for you and get rid of every single obstacle you might encounter because of the intention of like, I don't want you to struggle, but it actually sets them up for failure because I don't know how to struggle. And I think that that's what you're saying. It's not that we're doing these things to make them have this kind of everything's just the follow the yellow brick road of being a student, but it's like, yeah, it's hard. It's hard for all of us, and I'm gonna make sure I'm in your corner while this. And I think that's the difference between accommodations that set someone up for success and just giving that to them, right? It's not equity isn't about saying, here you go, don't worry about it. It's saying, well, I'm going to make sure that whatever your needs are incorporated, but within the demands of this whole thing.
Anybody else have anything related to vulnerability that they'd like to add? Okay. Well, I'm going to give you a chance to just offer any final thoughts or words of wisdom. If there was something I didn't ask that you hoped I had asked, or just something that was on your mind or heart to share, I would just love to give some space for that. So.
I was gonna say, when I was in grad school, my stuttering course I took, my professor at the time, she actually offered me to kind of do a little presentation on my experiences. And that was a really cool thing to do just because I didn't really disclose a ton when I was in grad school, because I really didn't want to be treated any di differently. But it was really cool to just kind of like open up and kind of tell people things about stuttering that they probably didn't pick up from the actual class. And all of the f- f- feedback I got too was all awesome. So I feel like that would probably be a great thing for people to kind of offer at times too.
I was thinking like as we've all since all of us clinicians, all of us have had many supervisors. Everyone will, obviously. So you have an opportunity to be that person. You can either be that person or you can be that person. Um, and that's the opportunity there.
I love that, Jack. I think that's just universal, that if we could tell any human sharing space with another human, think back to how, like, when you felt witnessed, and seen, and how, I just to call back to that and move forward in that way. I think that's really beautiful. Universal, right? And I just want to thank you all for sharing your stories. And I'm really excited to see this go out into the world and hopefully empower supervisors and, of course, better graduate students who stutter, their lives, their experience, and then how that can impact how they go out in the world and serve their clients and people and communities.
Yeah, I would say, if you're a supervisor and you have a student who stutters, approach the situation with compassion and curiosity rather than fear and judgment. And, if, competency is about, do they have the knowledge and the skill to carry out the clinical interaction, not the manner of delivery. So, and don't be afraid to have conversations, open conversations with your student and problem solve things together.
I echo everything that was just mentioned here. And, this quick thing just popped into my mind, but I'm not sure if this happens. I think it comes from my own experience of, I think, boy, like, how would I have done it if I was not working on my own communication in therapy, in speech therapy at that time, to help myself relate to stuttering in, more positive, healthy ways to actually allow space for it to be there. That's what I was working on at that time in my own therapy and desensitization, and to be able to, the ability to, talk about it in healthy ways and advocate. And I don't know if a student were to come to a supervisor and say, I want help with this, like I want to grow in this, where could the supervisor direct them, right? To be able to support them if it's coming from the student, that they want, you know, to work on their communication and speech therapy. And that, yeah, that's okay. And that can be really, really helpful if it's coming from the student. And yeah, that just came to my mind that that may come up. And all I can speak to is my own experience is that that's been a choice and it's still ongoing. I still look at it as I'm on my journey every day. And it's very humbling, but um, yeah, and I just appreciate having the space with all of these amazing people here. So, Ana Paula, thank you.
Yeah, I appreciate you saying that, Kyle, because I think there's space for there to be therapy, like you said, if that is coming from the person's desire to continue growing as a communicator, and that shouldn't be off the table, right? Like it's still a part of choice. And so I love that. So I just have jotted down a few words that have just stuck with me through this conversation, and I'm just going to read them out loud. Relationship, choice, listening, discovery, problem solving, brainstorming, vulnerability, and presence. Those are, I think, good words to end on. And we are going to close here, but would say this is just the beginning, really. We are developing other resources for clinical supervisors working with student clinicians who stutter. We have reached out to more SLPs who stutter, nearly 60 that are helping us create resources, and really just Spero is looking for just input from those that have lived it and who understand more than I do about this topic. And so those resources will be available through our website at sperostuttering.org and through our social media channels. So stay tuned. And thank you, Derek, Kyle, Jack, Lauren, Mandy. I just am honored to know you and to just be able to engage with you in community, and just really appreciate all that you do, all that you are, and just for sharing your stories with us. Thank you so much.
Thank you, Ana Paula.